Welcome to Bangkok Hospital Expert Talk with the Eye LASIK Center. Thank you for joining us, Doctor. Could you please tell us a little bit about why people over the age of 40 find it difficult to read?
Because you don't reach that age yet. You don't understand. But the people who is more than 40 years old, when they read, you can notice that some people need to wear reading glasses. Why is that? This is the eyeball, right? This is the lens, natural lens inside. And this is like a circular muscles. When everyone is reading, this muscle kind of squeezing the lens to become bulging so that they can read up close. And when you look far away, this muscle will be relaxed, just like so. But once you approach like 40 in the Asian people or the 45 in the Caucasian people, the lens getting harder, stiffer. The muscle is getting weaker. That's why started with like, they have to stretch their arms a little bit so that they can read. Eventually, when your arm's not long enough, that's why you need to wear reading glasses. Yeah, it's the normal aging process.
So the muscle helps to like zoom in and zoom out.
Right, and if you think about the camera, yeah.
And what would be the treatment, or how would you help improve?
Basically, like for most of the people, they are wearing reading glasses, correct? But you need to put them in and take them out. So the other thing that nowadays we can do is to do the laser on the cornea to improve the depth of focus, to keep your reading distance. How so? This is the cornea, right? If the one who's wearing progressive glasses, it's kind of like similar way. We do the curve of the cornea here by the laser, so that when you look downward, you can see up close. When you look far away, you can see with the center of the cornea. So this way you can keep the distance and reading within one eye. So there's no confusion that much compared to the disparity with the monovision, one far and one near. But for this, it's so-called FemtoLASIK presbyond. Yeah, the cornea will have like at least two curves to see with. That's why you have to compromise the distance vision a little bit.
So they can't see as far as they would normally.
Right, but not like sharp, perfectly sharp. How it's going to be like? Normally when we do the eyes evaluation before the LASIK, we have the trial lenses to put in front of your eyes. And let's see how you feel. Most of the people can deal with it, but some people don't like it. If that's the case, they cannot do the FemtoLASIK presbyond. They may need to wear reading glasses. But most of the people, let's say 80% of the people, they like it. So if they pass the test, they can do the FemtoLASIK presbyond. It's more tolerable compared to the old-fashioned monovision in the past.
And who would be a good candidate for that surgery?
So number one, the one who has the reading issue. Yeah, for example, the one who's more than 40 to 45 years old. Number two, you need to have the normal eyes, for example, normal corneal thickness, normal tears, and normal eyes examination. And last but not least, you need to deal with the disparity or the curves on the cornea, which will be shown during the eyes evaluation with the trial lenses. If you can pass the test, you can have this done.
And what would you say the superior benefits are to this?
Yeah, so this one is more tolerable. So you can look far, intermediate, and reading at the same time. Not confusing compared to the wearing progressive glasses or the monovision contact lenses. So it's easy to cope with. And the sharpness at each vision, at each distances, doesn't decrease that much compared to the other types of correction. Not all lasers have this kind of laser presbyond profile. In some LASIK center, they just have the monovision correction. For this specific presbyond profile laser, it is in some particular laser, which Bangkok Hospital has it.
And why should they choose Bangkok Hospital for the surgery?
Yeah, number one, we have the standard, right, of the everything. JCI, cleanness, and the technician who has the experiences, and doctors. We've done this for more than 20 years. Yeah, we have lots of data. Yeah, and this kind of particular presbyond profile, just in some LASIK center. I think we are the one who've done most of the presbyond profile in Thailand. I'm not sure if any LASIK center can do that. You can ask.
So very experienced.
Yeah.
Thank you so much for sharing the information. It was very helpful. And thank you for watching. Please join us in our next episode.